Hi, I'm Dr. Shire.
And I'm Dr. Scott.
And in this video, we're going to talk about the role of laser therapy and neuropathy, one of my favorites. As we mentioned in previous videos, neuropathy is a degeneration of nerves. Why? Because they're typically dying off because they're not getting enough blood and oxygen. Now, there are a lot of causes to why that occurs, but for our purposes right here, we just want to take it for face value that those nerves are not getting enough blood and oxygen. So, how does laser work, Doc?
Well, laser floods those tissues with light, really, and it penetrates really deep down into the tissues, all the way to the most deepest recesses of our feet or hands or arms or legs or wherever this neuropathy is. And in doing so, it brings tons of blood and oxygen to the tissues, and that's what our bodies need to heal up, ultimately, is blood and oxygen. In addition to that, it also speeds the rate at which our bodies or our cells can take up that oxygen. So it can eat more, it can drink more oxygen of this life-saving substance than the cell could on its own with that amount of blood. In addition to that, it also stimulates the body to create new blood vessels. And that's key, because that is how building a new fresh set of blood vessels in those tissues, that allows those tissues to be sustainable. So a person does not have to get treated for the rest of their life for peripheral neuropathy. They just need to get treated enough to where that can be a sustainable source of blood and nutrients for those tissues to heal on their own.
Yeah, out of all the things that we've seen and we've tried with our neuropathy patients, my feeling is, I believe it's yours, my feeling is nothing's going to get you closer to where you want to go that I've seen than laser treatment. So it's very effective for regenerating, helping to regenerate nerves, giving the nerves an environment to regenerate in. Typically, we tell our patients we may not get 100% improvement just because neuropathy is such a difficult thing to reverse. However, in many of our patients, we will typically get between a 60, 70, 80, sometimes 90% improvement in symptoms. And when you're dealing with this problem, to have even a 50% improvement is like day or night. Imagine having a 75 or 80% improvement, which is doable oftentimes with laser treatment in our experience. So that's just a little bit about laser therapy. You can go on, there's lots of information out there on laser therapy, lots of people using it in different capacities. We are using it very effectively for the treatment of neuropathy and been having some good luck with it. So if you have any questions, please feel free to ask Dr. Scott or I at your next appointment. And otherwise, we will see you at the next video.
Thank you.